Watch as I bring the source closer to the target. Can you see the magnification?
Yep.
And then when I pull it back, we're much closer to the natural shape and size of that tooth. Basically, the radiographic shadow, they overlap each other, and this is called the penumbra effect. And so by pulling it back, we're getting a sharper, crisper, more beautiful image for the doctors. As I move my flashlight, I'm moving the shadow. Let's say I couldn't quite get that third molar. It's just no way am I going to shove that X-ray sensor way back in the patient's mouth so that I can capture that molar. But what I can do is I can take my PID, my position indicating device, and I can move it distal, and I can project so that I capture those apices. Back in the day, we all used film. When a patient would express discomfort, then what we would do is we would grab edge ease. If that didn't help, we'd grab the snap array. But when it came now to the wired sensor, things are different. The wired sensor is bulky and it's hard, and the plastic barrier is slippery, and the plastic barrier can be sharp. The plastic barrier can rip. These are some of the challenges that we have now with the wired sensor.
You know, I've always had just one goal for Dental Assistant Nation, and that was to reach as many dental assistants around the world as I possibly could. So thank you for being a part of the community, and I want to make sure that you have hit the subscribe button so that you can not only help us spread the message and we can grow our reach, but also to make sure that you are getting the latest episodes delivered right to you the moment that we drop them. We are all about dental assistant education and empowerment here at Dental Assistant Nation, and we want to make sure that we are reaching as many dental assistants as possible. So thank you in advance, not only for being a part of this community, but for helping us spread the word. Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, proud to be the founder of Dental Assistant Nation. And thank you so much for joining us for this episode. Thrilled to have on today Janet Simpson. Hey Janet, how are you?
Good morning. I'm doing great, Kevin. How are you doing?
I am doing great. Glad to have you on. I've been excited about this because I know that you have so many things to share with our dental assisting audience about radiology and other things in that area. But before we dive into it, I'd love for us just to know a little bit more about you.
Sure. Well, I became a dental assistant in 1989, and I kind of fell into teaching. In 91, I was helping someone teach radiation safety courses. And that's my niche. I just fell into that groove. I love explaining things in a way that makes sense to people. And if that doesn't make sense, I explain it another way. And it's kind of a great outlet for my creativity. I worked mostly in general and in pediatric dental offices. I took a bit of time off to be a mom. And then when I came back to the field, I worked in the community college teaching dental radiography. And now I own my own business, Dental Fundamentals and Sensor Skins. And my day job is that I work at a pro bono dental clinic in City Heights of San Diego, serving people who have no access to dental care.
That's awesome. It's great to hear that there's dental practices that are still taking care of those in need. And thank you for doing that. That's truly appreciated.
It's a joy. It's like the highlight of my career, honestly. I love working there.
Well, you mentioned teaching, and I know you have so many tips that can maybe help dental assistants whenever it comes to x-rays and what they can do to better work with their patients in the practice. So I'm just going to pick your brain for a minute. What's something that you'd like to share with our audience in that regard?
Well, thank you. I believe that when you're taking dental x-rays, you need to have as many tips and tricks up your sleeve as possible. Because the patient comes in, and every patient, of course, is different, and they all come in with their own challenges. Like, there's a percentage of patients that come in with these big, beautiful, perfectly aligned teeth and giant palate, no problem, just take those x-rays in the standard way. But then you have people that come in with massive tori or with palatal tori or with shallow palates, touchy gag reflexes. And so for people like that, the apprehensive patient, you have to have a few tricks up your sleeve. So back in the day, we all used film. And it was pretty straightforward, not a lot of confusion around that. When a patient would express discomfort, then what we would do is we would grab edge ease and
Mhm.
we'd just peel this little styrofoam piece off and we'd wrap it around the sharp corners and we'd go forward from there. And that helped. If that didn't help, we'd grab the snap array. And so we had some tricks.
Yeah.
But when it came now to the wired sensor, things are different, quite a bit different, because the wired sensor is bulky and it's hard, and the plastic barrier is slippery, and the plastic barrier can be sharp. The plastic barrier can rip. And so if you tried to use these with a wired sensor, you're not going to get very far. It's not going to help. So there are a few things I just wanted to point out. These are some of the challenges
Yeah.
that we have now with the wired sensor as compared to the film. As far as tricks go, there's one thing that I feel like people don't know that I wanted to share. And that is quite often when we take dental x-rays, we place it in the patient's mouth, and then this little aiming ring on this stem, most of us push it toward the patient's cheek so that we reduce the distance between the source of radiation and the target, the
Mm.
image receptor. But that's exactly the wrong thing to do. What we want to do is actually pull this back and aim from there, because when we increase the source target difference, we're going to reduce the magnification. So, getting in the weeds a little bit.
Do it. Do it.
X-ray beams, the central ray is beautiful, powerful, effective, but the X-ray beam comes out in divergent rays as well. So we columnate it, we focus it as best we can, but in the production of X radiation, we do get divergent beams. And so I brought my little tooth model here.
There we go. Let's see. And by the way, I want to mention, if you're listening to this, make sure you're checking out our YouTube channel, because this is something that's very important for you to see. So please, Janet, go ahead.
Okay, thank you. So what I'm doing is I'm taking my flashlight, and the reason I'm using a flashlight is because visible light and X radiation have a lot in common. But with visible light, we can actually see the effects. So take a peek at this. Watch as I bring the source closer to the target. Can you
Yeah.
see the magnification?
Yep.
And then when I pull it back, we're much closer to the natural shape and size of that tooth. So when we push it forward, we get magnification, and basically the radiographic shadow, they overlap each other, and this is called the penumbra effect.
Huh.
And so by pulling it back, we're getting a sharper, crisper, more beautiful image for the doctors to be able to diagnose with.
That's a great tip.
Yeah, isn't that fun?
It is. Absolutely. Go ahead.
And even on my YouTube channel, you're going to see videos of me bringing the tube head forward, because that's how I was taught. And I would say the majority of us have been taught that, but the opposite is true.
Yeah. And, that's just one of those hard habit to break maybe sometimes. But
Completely.
yeah, but
Very much so.
love that.
So, another thing that I wanted to bring to your audience is that, it's very common for us to make an error. You cannot be perfect. You have no idea which patients have those extra long roots, or there's just something hidden that you need to find. And so that's okay. But what we really want to do is, with that next image we take, we want to be able to correct the error. And so what I want to show you next is my technique for correcting those errors. And it's called shadow casting. And like I mentioned, the X-ray beam basically casts shadows like visible light does. And watch as I move my flashlight, I'm moving the shadow. So my tooth, for example, let's say this board right there is the image receptor. And let's say I miss the apices. I can bring my tube head down and I can aim up and I can capture the apices. Or let's say I couldn't quite get that third molar. It's just no way am I going to shove that x-ray sensor way back in the patient's mouth so that I can capture that molar. But what I can do is I can take my PID, my position indicating device, and I can move it distal and I can project so that I capture those apices. And that's shadow casting. It's one of the magics of shadow casting that I'm super excited about.
I cannot wait to be a part of the Rocky Mountain Dental Convention in 2026. We're going to be talking about the real state of dental assisting in 2026 in Denver on January 22nd and January 23rd. So I want you to be a part of this because dental assistants, we're going to bring you together in the Mile High City at the Rocky Mountain Dental Convention, and we're going to be talking about the things that are going well in the profession as well as the things that we can improve. It's going to be a great time of learning. I want to see you at the Rocky Mountain Dental Convention in Denver, January 22nd and January 23rd for real talk about the state of dental assisting in 2026. Join me and let's be real with each other.
Love that. And I want to just reemphasize something you said, that you have a YouTube channel with so much
Yep.
great information.
Yeah.
So we're going to link
Yeah.
that in the show notes as well as our YouTube channel to make sure that you're getting the full effect of Janet's teaching and everything else. Janet, you and I were talking recently and you told a great story to me about x-rays and patient comfort and how important it is just to build that trust even with getting the x-ray right. And I want to
Mhm.
share that with our audience because I thought it was so impactful.
Absolutely. Yeah, thanks for that opportunity, Kevin. I told you I work at a clinic where there's no access to care. People, many of them have not had dental care for over 20 years, some 30, some never in their lifetime. But I see many people who are very apprehensive because they had a really negative event in their past. They went to the dentist and somebody was uncaring or they just had a terrible experience. And so it's very hard. It's almost visceral. They can't control it, but I see them shaking, then crying, and just unable to just open their mouth. And when a new patient comes to our office, any of us, basically we bring them to the back, we go over their health history a little bit, we take their blood pressure, and then the first thing we do in the mouth is we take dental x-rays. So this is our opportunity to set the tone for the office. I would just like to encourage all of the people that are listening to exercise compassion and empathy for your patients in that situation. The story that you and I were talking about, Kevin, is that this darling little girl came into a pediatric dental office that I was temping in, and she'd been undergoing chemotherapy and, just tremendous suffering that this tiny little one had to go through. And I was kind of warming her up, like, this is Mr. Thirsty, this is our squirt gun, and just kind of developing a rapport with her. And another dental assistant came in and she shooed me out and she decided that she was going to take the x-rays. And I heard the most blood-curdling screams coming from that operatory because that woman had just, open wide and cram it in there. And I've seen that more than once.
Sure.
That a person was just like, hey, you're getting healthcare open wide. And that's not the way. It's heartbreaking. And it has an effect, a lifelong effects. So the trick that I'd like to share, and thank you for that opportunity to share that. It's sad. It just breaks my heart when things like that happen. So here's my trick. So when a patient comes in and they sit down and I get the whiff, just the barest whiff that they are nervous, I will take my first x-ray will be the maxillary right premolar image. So most of us, we're all taught the first x-ray we take is the maxillary molar image. But if I'm going to take this big bulky sensor and I'm going to push it way back in your mouth, like the first thing I do to you and, trigger your gag reflex, the whole visit just goes differently. And so what I do and what I recommend is place it in the premolar area, take the x-ray, and then check in with the patient. How was that? The patient will go, I was fine. Okay, great. I have to get back a little bit farther now. And then we just slip it back farther But patients have tricks. They have their own bag of tricks, and they'll tighten up their cheeks. They'll ball up their tongues. They'll like open wide, like they won't open all the way.
Yeah.
And so if we gain their trust right at the beginning, we're doing everyone a favor. We're going to be, getting more excellent x-rays. We're going to take them quicker. We're going to take them more comfortably, and everyone wins that way. So those are some of the tricks I've got.
They're good tricks. And I think it's good to remember them whenever so many dental assistants are feeling rushed. They're feeling like, the schedule's falling behind, whatever it is. And as you said, sometimes we just want to say open wide and stick it in there and be done. But it's good to remember the people side of things as well. So I love that story when you first told it to me. Yeah, it makes my skin crawl a little bit, honestly. So I'm really glad. That.
Yeah, it has to do with the culture of your dental office for sure. You've got some offices that you're just moving a mile a minute, and we all want to be efficient. But when your patient is fighting you, you're not going to move very fast. So if you develop a good rapport and get their cooperation, there are times when I say to the patient, I can see that they don't want me to go back to where I need to go. And so I'll point out on the screen, I'm like, listen, I need to get the apices. I need to get down just a little bit farther. So if you can work with me and if you take your finger and push it back for me, and if you put the patient in control, things go so much better. Even little ones to a 3-year-old to an 85-year-old.
Absolutely. Absolutely. You mentioned sensor skins a few minutes ago, and I know that's your project and a passion project of yours. So tell our audience a little bit about that and what that does as well, please.
Yeah, well, thank you. Well, in my experience teaching dental x-rays, when it came to the sensor, one of the things I noticed was that the sensor will slip out of the sensor holder because of the plastic barrier. And that's frustrating for the dental operator. And it's not a confidence builder. The patient looks at you like, what's the problem? Why can't you keep this thing in?
Yeah.
So that's one issue that we've had. Another issue is it's so bulky and hard. It's painful. And then the barrier can be sharp. So, Kevin, I worked on this invention I thought it over and over and mulled it over in my mind, like, how can I solve these problems? And one day I just had this aha moment by looking at my phone case. And so I created sensor skins so that just like your phone case, you just slip it in and the sensor's held on all 4 sides. It's going nowhere. When I place it into a patient's mouth, even if they have their tongue balled up, even if their cheeks are tight and tough, I can win that battle and I can place the sensor where I want it in the patient's mouth and it stays there. And then the other thing is that it's comfortable for the patients. So when they have those tori or, just the mandibular anterior especially gets very uncomfortable because the mucosa is so thin there. Did you know that in our body, the sensory organs, 19% of our sensory nerves are located in the mouth?
Oh, wow.
So that's why everything feels like a mountain in your mouth, and we're very sensitive there. So that's why we'll do well to pay attention to our patient's comfort level there, especially when taking dental x-rays. So I've been using this for over a year and a half. My patients love it. Like I said, you can't use edgies anymore. It's just not effective. But when you've got that tender person, when you've got somebody that is anxious or they express that they're in pain, Sensor Skins is an awesome opportunity.
The Chicago Midwinter Meeting. It's one of the biggest meetings in the dental industry every year, and this year is going to be extra special because I'm going to be talking to dental assistants at the meeting, and I can't wait to be a part of it. So dental assistants and dental team members, join me Friday, February 20th, as we talk about harnessing the powers and personalities in the dental practice. Why can't we all just get along? We're going to talk about that. And then Saturday, February 21st, it's going to be extra special because dental assistants, this one's just for you as we talk about battling and beating the demons of dental assisting. So join me at the 2026 Chicago Midwinter Meeting. I can't wait to see you in the Windy City.
So where do they learn more about Sensor Skins? Let's go ahead and let people know.
Okay, well, sensorskins.com. So that's sensorskins with a Z.com.
There you go. Look at that right there. And we're going to have that link in the show notes, whether you're listening to this, whether you're watching it, whatever. It's going to be easy for you to find that. Janet, as we wrap up, anything we didn't touch upon that you want to leave with our dental assistants?
Thank you for what you do. That's what I want to leave with your dental assistants. I've mentioned the clinic many times. It's been revolutionary for me. It's been a real shift in my mentality. I've always been empathic, but seeing these patients who have not had care for decades, what you do as a dental assistant is so vital. There's so much misery and so much suffering if we don't provide dental care. And so you extending that welcome, you providing that bridge between the patient's concerns and the doctor's ability to provide that care is invaluable. And so just know how valuable you are. Rest in that. You don't have to prove it to anybody. Live your values. Be empathetic. You went into this profession because you care. And I say, never, never, never let that go. Even if some front office manager is pushing you, you stay true to you. You stay true to that caring, loving heart that you have.
I can't top that. Well done. Well said, Janet. Thank you so much. And seriously, I appreciate the tips because I think so often it becomes almost robotic, and it's good for us to remember there's the human side to it as well. So thank you so much.
100%. Kevin, do you mind if I pitch my class real
Pitch.
quick?
No, please.
So I have a whole 2-hour course on how to take better dental x-rays on my website, dentalxraycoach.com. And in that, as far as giving your viewers additional tips, the bisecting is rarely taught. But I have that on there. And so anyway, if you'd like, I can give a coupon code and give 10% off the class. It's very affordable, but I'll give a coupon code. The coupon will be Kevin.
Oh boy. There you go. Well, that's great. And that'll be in the show notes as well. So easy for you to find, easy for you to interact with that. And absolutely, the more the dental assistants can learn and stay on top of their game, the more important it is for all of us in the dental industry. So thanks, Janet. I appreciate that.
You're welcome.
And thanks to all of you for listening to this episode of the Dental Assistant Nation podcast. Absolutely important things to remember. And I'm so thankful that Janet came on today to share some. I have a feeling we'll have her back on a future episode to share some more tips and ideas with you as well. Until next time, it's Kevin Henry, founder of Dental Assistant Nation, signing off. And as always, wishing you nothing but success ahead.